For the first time in half a century, scientists have hit a new treatment for asthma attacks. Clinical trial results have shown that a drug called benralizumab is effective at treating acute attacks of both asthma and COPD, and it works better than the current standard treatment. Patients reported faster symptom recovery and improvement to a quality of life, making the therapy especially promising. If this clinical trial is to pass, this could become the first new treatment of asthma and COPD in over 50 years. I'm now joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us.
Thanks for having me.
Now, how is this new treatment having such a positive impact on treating asthma?
So benralizumab is making a significant impact here. We're seeing that it's quite new as well, but it's an injectable medication for asthma. So it's a monoclonal antibody. And what we're seeing, and there's a lot of excitement around this, is because benralizumab really targets eosinophils, which is what causes a lot of inflammation for asthma. So if you target the inflammation, what you're going to see is a lot of changes in quality of life, improved lung function as well, and you're going to experience fewer symptoms like wheezing, coughing, and chest tightness. And quite importantly as well, even though it's an injectable, this is something that could be done in a GP practice or even at home.
Now, I read that this drug is already used in more severe cases of asthma. So, why has it taken scientists so long to realize that this drug can be used regularly?
Yes, I think this is the complexity of that is because asthma is not really a single disease. We just call it asthma, but really it's a syndrome of different subtypes that we have. We have non-allergic asthma, allergic asthma, late onset asthma, asthma with fixed airflow, and asthma with obesity. So we have different types of asthma, and they respond differently because the triggers can be quite varied as well. Sometimes it's irritants like smoke and pollution, and sometimes it's certain molecules or certain white blood cells like eosinophils that are causing the inflammatory pathways. And that's where we're seeing benralizumab is going to be much more effective there to work on the eosinophilic asthma.
Now, I do want to stay on the topic of different types of asthma. So, the study shared that scientists are finding that not all asthma attacks are the same. Does this mean that the drug can be a game changer for some people and have no effect or a negative effect on others?
Well, you're right. I think there's a lot of variability here that we're going to see, and we have to keep in mind, there's always excitement with a new drug, but certainly it's not going to be a fit-all for everything there. For eosinophilic asthma, certainly we're going to see huge improvements there. I think it's going to be highly effective there. Now, for people without eosinophilic asthma, it may not be as effective, and in some cases, it may not have any effect at all. So what we have to look at is what type of asthma the patient has. And what's exciting about this is our change from just generalized medicine to more specialized medicine based on the patient.
Now, asthma is thought to affect more than 262 million people globally, and COPD was one of the leading causes of death worldwide. I'm curious why it's taken doctors 50 years to find a new potential treatment with such a common illness.
I mean, it's a very good point. I think what we're seeing in medicine today is this big change towards monoclonal antibodies. With vaccinations, we saw that big change with mRNA vaccines, and now we're going to see these antibody medications used. We use some of them now for cholesterol as well. Repatha is used for cholesterol, and it is, again, a monoclonal antibody that we use. So I think this is going to be something that we see in medicine moving forward, where more and more of these products are going to be similar, injectable, maybe once weekly, maybe once monthly, which help control inflammatory symptoms.
And although it is still in the clinical trial stage, how promising is this drug to people who struggle with asthma and COPD? And could this potentially change the way doctors treat other respiratory illnesses?
I think so. I think, when we look at asthma patients, we look at COPD patients, oftentimes it's similar, if not the same medications that are used. Benralizumab in this particular case has shown a 74% reduction in annual exacerbation rates compared to placebo. So that's a huge improvement when we're looking at that. There's certainly trials with COPD, and we are expecting that we are going to see something very similar for COPD as well. And if it does continue to show very positive results, I think it's going to be a big game changer for both asthma and COPD. So we're definitely all keeping an eye out on it.
Now, we do just have about 40 seconds, but I'm curious, are there any side effects to this new drug that's been going through trial?
Yeah, it's a very good question. I think usually with monoclonal antibodies, we don't expect too much of an issue with that. Having said that, it's a very new product and it has to go through all of the clinical trials, and that's where this all comes in. So, do we expect long-term or short-term side effects? We don't expect them, but we do need to do the proper clinical trials to make sure we're not going to see them in the future.
Dr. Raut, thank you so much.
Thanks so much for having me.
All right, don't go anywhere. Coming up after the break, we'll have more of today's top national and international headlines. You won't want to miss it. Don't go anywhere.